get some gloves and we'll put a little hole there and see if anything comes out, huh?
Okay.
If you feel anything, it's not my fault. Yeah, like I said, I'm doing this because you've been on this Keflex for a while. How long now?
2 days. So
2
I've had
days?
8 pills.
And it's worsened.
Yes.
All right. Jesus, a lot of that shit. So, we'll see. Keflex will cover most of the bugs. And that reminds me, let me see if I get a culture. There's another bug that Keflex won't cover, which is MRSA, which is kind of like staph. It's a staph infection,
Right.
but it's kind of like staph with a tank top. You know, it's strong and fights off lots of antibiotics. Okay, so it's, you know, our antibiotics resistant. So that would be one reason why I didn't get better with Keflex and worsened. We usually add another one if that's the case. So let me find a culture tube. So if I get it out, sorry, here we go.
If you get it out, you can take it and find out what it is.
There you go. Regardless, I'm gonna still put you on something to
else.
cover MRSA. That's right. And also, the treatment of an abscess, by the way, isn't antibiotics. Not that it was the wrong thing to do, because he or she was probably just trying to cool it out and get.
Yeah, but it didn't. I mean, it looked infected. It wasn't bulging like this 2 days ago. Right?
Right.
Mm-hmm.
Skin line. Cut it with the skin lines.
Wow.
And you can see that there it is. Yes, we smell it. I smell it. Just gonna put this in here. Get this goop that's in here. And use it to break up some of the. I always say this. An abscess is, picture this, an abscess is kind of like
Get
this.
my phone. I want to put you.
An abscess is kind of like this building, okay? And what ends up happening is pus goes in the hallways, and then it goes into the rooms, and
Right.
it locks the door behind it. So now you got all these rooms with pus in it. So we need to break up. We need to break up the walls.
There you go. Just take a couple pictures.
You just want a picture?
Just a couple pictures is fine.
And you can see the gross part is, well, this goes all the way to here. Look at it, it's gross. So most people just put this in once and then they're done, but I'm going to use it to break up the infection a bit. You can see that it goes to here.
Wow.
The infection is really tough. It really eats away. So that's all I'm going to do with that. Now let's just see if we can have a little fun, right? See if we can make you feel a bit better. So,
You don't feel anything?
I don't think.
I did put it deeply, the numbing, because I had a feeling that if we did go in, we would have to break it up a little bit, so.
There's more than doing what she did without anesthetics.
So I was going to push a little bit. And you can see this bad tissue right there.
Yeah.
A little bit. So I just like to push it because I can break some of the walls down that way. You let me know if I pushed too hard. Okay, let's go in there. You're doing good there, buddy. So I'm obviously glad we went in. It's a big cavity and this is going to heal just fine.
Awesome.
Now the one problem is that's a pain in the ass for you, is it will need to be packed.
What does that mean?
It means I need to put some gauze in there,
Okay.
which means every couple days you need to come in, have it taken out, and put in. Because if it closes too soon on the top,
Then it won't heal underneath.
it will just fill up again and form another abscess. So we need to have it heal, bottom up. And the way we do that is we put in some packing, which prevents early closure. And if we're aggressive enough, which I like to be, they take out a good amount every time they see you, and it will close over it. Close quickly. A lot of people pack it too tightly. And when they do that, it just stays open. And I think we're good. Looks like got all the pus a little bit more. See this?
Yeah.
Tissue? That stuff.
My daughter got bitten by a recluse,
No way.
and they had to pack it, and it was going.
You know, brown recluse are horrible there. I'm sure you learned all about it, right? They have neurotoxins. So it's not uncommon, she got lucky, that people lose their limbs. They lose part of their nose. They lose fingertips from getting bit by a brown recluse.
Wow.
I had someone bit.
She's really lucky.
Yeah, these things are, they're really nasty spiders, man. One of the worst to get bit by. I think we're good. Sorry, no, that's hard to watch when I'm doing
It doesn't bother me.
Okay, good. So I'm just trying
You can watch all you want. eh?
Yeah.
just trying to break it up. And we'll get a couple 100,000 people watching it too. Just for you. Watching this hole in your arm. You don't know what it was though, right?
No. See, we thought it was for me scratching it.
Could have been and just introduced.
Yeah.
I don't think it was from a cyst.
No, it wasn't like that. It was,
That was a rash at first.
so I had a rash
Yeah.
just in that section.
Yeah, we're good.
And so you can see like right there,
Yep.
that's where I scratched it. And I scratched it, it was like this section.
Okay. So, 1/4 inch iota form. Isn't that nice? You get to keep this. So, you know, we have staph is all over us, Staph aureus. This is the bacteria that's responsible for 85% of skin infections. Abscess, paronychia, the skin or the infections around the fingernail. This is all Staph aureus, about 85%. That's the SA and MRSA. It's Staph aureus. MR means methicillin resistant. So I'm just going to take a lot. Don't worry, this isn't all that's going in there.
Whatever you gotta do.
We'll just start with this.
Okay.
But so my point was we have staph all over us as a normal kind of flora that protects our skin, interestingly. But when it gets to places it shouldn't be, it starts to cause infections like that. And when you start giving too many antibiotics, geez.
Somebody dropped something.
Yeah. When everybody okay?
Was it in this one?
No. When everybody starts, when doctors and people demand antibiotics and doctors give too many antibiotics, we start building really strong bacteria because they're like, oh, I've seen that before. I know how it works, so they build a resistance to it. So the first one I'm going reasonably, I'll probably take some out, but it'll help me see how much I could go in here.
Okay.
This is frustrating for you, I'm sure, because you'll have to come back in and
That's fine.
repack it.
I'll have to come in twice.
Should I come back here?
Usually, yes.
Okay.
That's good. I wanted to pull a little bit out so it's not so packed in. And that's good. We're going to put a little antibiotic ointment in there, wrap her up. Him up, excuse me. Wrap her up. And then we'll talk about follow-up.
Okay.
Is it okay to take probiotics while you're taking the antibiotics, or do you wait until the antibiotics are over and take the probiotics?
That's a great question. I think you'll have a controversy over that, but because not all antibiotics kill all bacteria, but it would probably be worth it just to, I suppose if you took it along with it would be fine, and just continue it after.
So
Okay.
that's
Yeah, that would be fun. Because like I said, not all antibiotics kill all bacteria. That's an
Oh,
important one, okay? That's why we use certain antibiotics for certain infections and others not. So that's good. Got our culture. Let's keep it there. We'll get you all cleaned up.
okay.
Stop moving.
So how much pain am I gonna be in after this wears off? How much pain would a normal person be in? Let's go with that.
Look, it's interesting. I find that it's quite variable.
Okay.
Because when you anesthetize the skin, it's almost like you turn the brain off turn the brain off to what's actually happening. Like it puts a short circuit between what you're doing and what the brain's experiencing.
Right.
And sometimes there's a little bit less pain. Sometimes there's like very little to no pain. But everyone's different.
Right.
So it's hard to say. I'll make sure to top you off with some good medicines. We'll give you a Tylenol with codeine or something just to kind of ease it. You can take some ibuprofen, that would be fine too.
If I don't need it, I won't take the
Okay.
Tylenol, but
I'm gonna give it to you.
good to have it if I need it.
Yeah, you could sell it on the street or something.
Pardon?
You could sell it on the, you could sell it to the,
Sell it to one of my buddies.
yeah, you may want to do. I'm supposed to say, just kidding, like you didn't know that. Hold on.
So how much do you suggest we sell it for?
Well, if you give it to the little kids, you probably just should give it to them.
Oh, wow.
Because they probably can't.
Oh, I see you have the same problem with gloves as I do.
Yeah, we need gloves that are made for men.
Men,
Just put a whole bunch of this stuff on here.
antibiotic ointment.
Yeah, just a little overzealous there, but that's what I
Hey,
do.
you know what?
That's what I do. All right. Let's.
We're gonna wrap it up, assuming.
I'll have to just come in and just
Okay.
finish that off.